So the first presenter is Dr. Raj Hirani. Is there? Oh, thank you. Sir, start. Kar. Good morning, sir.
Hello. May I start? So, good morning everyone. I am Dr. Raj Hirani and I'll be presenting our study titled Are Glaucomatous Eyes with Lower Baseline Corneal Hysteresis at Risk for Faster Progression? This was a study conducted in South India with Ethics Committee approval and I have no financial disclosures. So, in 2023, like every year, the American Academy of Ophthalmology brought out a comprehensive report or the ophthalmic technology assessment to evaluate the clinical utility of ophthalmic response, ocular response analyzer or ORA in the risk assessment of glaucoma progression. But what does it do? The ORA uses an air puff to indent the cornea and measure the pressure required to flatten the cornea. As the cornea returns to its resting position, a second applanation pressure or P2 is recorded on its outward movement. The difference between these two pressures, P1 and P2, is referred to as corneal hysteresis and is indicative of the corneal viscoelasticity. This corneal hysteresis value is also believed to be indicative of the global biomechanics and the lamina cribrosa stiffness, which can thereby affect the eye susceptibility to glaucomatous damage. So, in their OTA report, they found 4 longitudinal studies on open-angle glaucoma patients, which were all from the US, and showed that lower baseline corneal hysteresis was associated with a faster VFI decline. Hence, they concluded that eyes with lower corneal hysteresis have a greater risk of glaucoma progression, and the ORA complements current glaucoma diagnostics. So, does this mean that we should all invest in an ORA? Before extrapolating their data to change our management, we decided to conduct a study to evaluate the association between the baseline corneal hysteresis and progressive visual field loss in an open-angle glaucoma population of South India. So this was a part of an ongoing prospective longitudinal study at our institute, and we included all open-angle glaucoma patients who had a baseline ORA report and a 5 subsequent visual fields. Out of the 225 eyes eligible, we excluded those with poor quality ORA scans, unreliable visual fields, and ophthalmic conditions other than glaucoma. And progression was determined by the rate of change of visual field index over time, which is known as VFI slope. The effect of demographic, clinical, and baseline ORA parameters on VFI slope were analyzed using linear mixed models. So coming to our results, this slide shows the demographic and clinical data of 98 patients which were included in our study. The mean age was 61 years and the mean pre-treatment IOP was 22 millimeters of mercury. The baseline corneal hysteresis was 8.2 and the mean VFI at baseline was 75% and over was 79%, and which was reduced to 75% over the 6-year follow-up. And the slope of VFI here we can see was significant. So then we looked for factors which affected the VFI slope using linear mixed models, and a univariate analysis found 2 parameters to be associated with VFI slope. These were higher pre-treatment IOP levels and baseline ORA corneal hysteresis. But further, on multivariate analysis, only the pre-treatment IOP was associated with a faster VFI decline. In our population, the corneal hysteresis baseline was not predictive of glaucoma progression. So how are our results different from the previous studies? One reason could be the ethnic and the genetic variations. For instance, a study conducted in the UK told that Asians were noted to have weaker corneas than Caucasians. Other reason could be diabetes. As we all know, India is a diabetic capital of the world, and it can significantly affect the corneal hysteresis. And finally, environmental factors like higher sunshine or UV light exposure can lead to change in the corneal biomechanics. This could potentially change our corneal stiffness externally, making it no longer representative of the scleral biomechanics and hence making corneal hysteresis unable to predict glaucoma progression in our population. So to conclude, in our South Indian population, there was no association between baseline corneal hysteresis and glaucoma progression. Only the increased baseline IOP was the major risk factor for glaucoma progression, and emphasis on obtaining IOP measurements using Goldman applanation tonometry remained the most important thing that we need to keep in mind. Thank you.
Doctor, this corneal hysteresis, is it related with myopia?
Yes, ma'am. So since myopic people have thinner corneas, so since corneal hysteresis is dependent on the scleral thickness also, it is already shown in multiple studies that myopics have lower corneal hysteresis. So the thickness, since it is low in myopics, corneal hysteresis is dependent on the refractive stage as in high myopics, yes.
So what you will do in myopic patients for the assessment of the hysteresis?
So for the measurement of corneal hysteresis, we will do the same. We will use either the ORA or the Corvis, the newer machine. But we have to take in account the scleral difference between the normal population and the myopic population, because that can significantly affect our results. So we have to take in account.
Because it will further alter
It will alter, yes, ma'am.
if you do the surgical correction.
Yes, ma'am.
So it is also a problem.
Yes, ma'am.
Not only the glaucoma, but this is also a
Yes,
problem.
yes, ma'am.
Okay, thank you.